This video will offer information on genetic testing for people with a family history of an inherited heart condition. When a genetic cause for the heart condition is known in the family, then genetic testing is available to family members. Your healthcare provider has referred you to a genetic counselor to discuss the option of genetic testing. A genetic counselor will ask you about your health and family history and explore with you the medical and emotional aspects of genetic testing. In this video, you will learn what causes inherited heart conditions, the option of genetic testing, and what results you can expect, and things to consider before having a genetic test. First, let's review some basic genetics. At the center of each cell in your body is your genetic information, also called DNA. A gene is a section of DNA that tells your body how to grow and function. There are hundreds of genes that are important in the health of your heart. Inherited heart conditions happen when someone is born with a difference, also called a variant, in one of these genes. Variants can impact how the gene works so that it cannot do its job. If a family has an inherited heart condition, they usually have their own specific variant causing the heart issues. When a variant is found in someone with a heart condition, this means that their biological relatives may also have the variant. A close relative, like a parent, a sibling, or a child, has a 50% or 1 in 2 chance of having the same variant, and a 50% or 1 in 2 chance of not having the variant. You have the option of genetic testing for the specific variant that is known in your family. One of the major benefits of genetic testing is that it can help clarify if you need to have ongoing screening and monitoring. Genetic testing in this situation can give 2 types of results: positive, you have the variant, or negative, you do not have the variant. For people who test positive for the variant, ongoing monitoring is recommended. Your healthcare team will talk to you about how to manage the condition, if lifestyle changes are needed, what precautions to take, and the benefits of getting early intervention. Some people who test positive for the variant do not develop symptoms. The genetic test cannot tell who will and who will not develop symptoms, or at what age they may appear. People who test negative for the variant do not usually need to have ongoing monitoring. In some cases, your healthcare team may suggest some tests to better understand your current health status. Because an individual with a negative result does not carry the variant, they cannot pass it to any children they may have. People can have many different reactions when they learn about genetic results or health concerns that may develop in the future as a result of their genetics. How would this be for you? Because genetic testing can tell you information about your health, you may have questions about your eligibility for life insurance. There is currently a law in Canada that provides some protection. For example, an application for life insurance should not ask about genetic results. However, the application may ask about medical conditions for you and your close biological relatives. Genetic testing is done by a regular blood draw at your local clinic. There is no cost to you for this test. As the testing is highly specialized, the results may take several months to come back. It is important to know that genetic testing has limitations. In most cases, you are only offered testing for the variant known in your family. A negative result does not rule out all possible heart concerns or health conditions in the future. Genetic testing is voluntary. This means it is your choice. If you choose not to have genetic testing, your healthcare provider will recommend other types of screening tests based on your medical and family history. There are many different things to consider before having a genetic test. Your genetic counselor is here to answer your questions and support you in making a decision that is right for you.